If they're a brain surgeon, they don't know anything about the throat. And even though it's 2 inches away from the brain, they know nothing about it. And they can't treat, they can't do anything anymore because it's become such of a money-driven thing. They don't want anybody to know much of anything. It's just, this is your job. You work on the feet, you work on the knees, you work on the hips, it's crazy. And there's no general practitioners anymore that can step in there and go, no, wait a minute, maybe they've got something else. And maybe they don't need a $10,000 MRI. Maybe they only need, an X-ray. So it's all money-driven because they do tests now that are totally unnecessary, and they do them over and over and over and over again just to cover the bases.
And again, it's the system. Yeah. It's the system behind, the situations. And a lot of times the doctors themselves, it's the system behind everything that just makes for such a mess.
Well, that's why I was saying we needed to have people to get together, and that's why I said I can treat so many patients. Maybe they will all get together and will fight, and that's why they're attacking me, because if it gets to a point that too many people are talking and saying, hey, this is good, this works, then they cannot continue what they're doing. So what do? Work on destroying me, so that will not happen. That's what's happening, and it's horrible.
And what's sad is that your clients, your patients aren't doing this to you. It's people that don't know anything about it that are doing it to you. But when you go to the hospital, the patients and the clients are the ones that are doing all of the malpractice lawsuits against their doctors and the hospitals because things weren't done right or things weren't done efficiently or things were done wrong. You're not in that situation because you're not harming anyone. But the people... But people that are trying to hurt you have nothing to do. They don't know they have nothing to complain about. They're not involved in any of this.
No, they're just indirect. And also a lot of cases, what happens is, like it happened in the case of Deborah. Deborah is smart and is a strong person, so when she was going through the healing process that was so difficult, she handled it right. But other people do not. They go back and go back to an oncologist, and they immediately put them on chemo, and they stay on chemo for a year, 2 years, then they die. What do they say? Oh, the doctor said, you have to go after that person that 2 years ago treated you, because that's why you died.
Yeah, but what they need to be looking at is how many people, they have a whole lot more people die just from chemo and radiation than they do from chemo, radiation, and laser surgery. They're killing people left and right with chemo and radiation. Left and right by the thousands. And no one ever says anything about that. They just say, oh, it was the cancer and we couldn't cure it.
Yeah. We couldn't help it.
How many people are there walking around today, right now, this very minute, that have had cancer for years and years and years and don't know it or chose not to do anything about it, and they're still walking around alive? How many of those people would be dead today if they were treated?
If they had chemo. Yeah, because some statistics that they were trying to cover up say if you have cancer and do absolutely nothing at all, you still can live 10 years. Now with chemo radiation.
No.
So.
Right.
It's just,
I want to bring... A very strong person. My dad's had chemo and radiation for prostate cancer and stuff, and some bladder problems. But my dad is a real strong individual, and it didn't even bother him. I mean, he only got sick once, as far as being... His hair didn't fall out. It turned gray, but it didn't fall out. And he just walked through it. But not everybody is like that. That stuff, I've seen people that look really good, went into the doctor, found out they had cancer, went on chemo and radiation, was dead in 4 weeks.
I know.
And
it
just
wasn't
the cancer that killed them.
No, it's the treatment.
Yeah.
Yes. Yeah, it takes the immune system down. I mean, geez, Louise.
But because it's the accepted treatment, then no one ever says anything about it. Why do we have to do this? Why can't there be something else?
Yes.
I don't know. And it's just awful because really the way the hospital said, they don't want to have any change in what's going on.
No, there's too much money in what they're doing. I'm telling you, it's all money driven. And I truly believe that. And if other people can't see that, then they're blind as far as I'm concerned.
Yeah. But, if they want to go and follow the standard because they believe in the doctor, that's their choice.
It is. It's their choice, and I'm not saying that's a bad thing for everybody, and it's not, but it's also not the best thing for everybody. So. But
they have no right to try to stop people that want to do something else.
Correct.
They have no right
that's
to do
it.
That.
Free choice and free will of absolutely. That's always been my big thing. If that's my treatment of choice, whatever that is, if I'd have gone Salvador, well, okay. But, this stuff works. I mean, I was a hard case. I was. I know it. Man, I lived through it, And you lived through it.
Yeah.
My husband lived through it.
We got a break coming up. Then, I'm going to bring in Krystal that you directed her. Yeah, okay.
Great.
All right. Okay, we are back from the break, and we have a very special situation here because in addition to Deborah still being here, she told you about her story. We also have a young girl, Krystal, and her grandmother is a friend of Deborah, and so we want to have Krystal tell you her story and what happened to her and what went on thanks to Deborah's advice, okay? All right, Krystal, are you there?
Yes, I'm here.
Okay, so you want to tell her what happened and what went on?
Well, when I was living in Texas, this was before my 20th birthday, I was still 19, and at the beginning of February, I felt something on my right breast, and I wasn't for sure what it was, and I was getting scared. And at first, I called my mom, and I told her about it. She told me I needed to go to the doctor and get a biopsy done and everything. And then I called my grandmother, and she told me she would take me to the doctor. And then that same night, she called me back and told me that we weren't going and that we were going to go up to Oklahoma to this other place, to Dr. Carpenter's place, and get treated and see if it was breast cancer. Well, we went up there, and I had my appointment, and it was breast cancer. I had 2 little lumps on my right breast, and it scared me because I was only 19 at the time. And I went through my treatment, and I think it was only the first time that I had my appointment, I had treatment that day, and then I had 2 other treatments. And I didn't have any problems at all. I'm very healthy. And I'm a lot better than what I was, and she helped me get over it, and she was there for me through me crying and everything, and by the last treatment that I had, it was already starting to go away, and then I just had my checkup this month, actually, and it's gone, so I don't have breast cancer anymore, and I'm really happy about that. So
it was easy too. So
yes, it was. It was very easy. All I had to do was do what Dr. Carpenter said, and I'm fine.
Yeah, see, and that was thanks to Deborah. That from her experience, she knew that coming early was a lot better.
Oh,
right,
yes.
Deborah?
Yes.
Yeah. So that was great. I told Krystal before, I was terrified she's so young, what they would have done to her. So it was great that you told her because she just next to nothing now. She's fine. She didn't even have the difficult healing. Yeah.
No, I didn't. But the one thing that I'm really glad that I did not go through the chemo and everything else because I don't want to lose my hair. So I just don't want to do that because I don't think I could have actually gone through it because I've heard how much pain and suffering you have to go through, and I don't want to do that. If there's an alternative solution to going through a treatment like with having breast cancer, then I'll go through the alternative if it's not bad and if it's not going to hurt me. I don't want to go through anything that's going to hurt me because I can't imagine going through that pain. And I've seen people who have lung cancer or anything like that, and they were going through chemo and radiation therapy, and they died within like a month or 2.
Yeah.
And
it's
just unbelievable. It really is.
Yeah. But it's great because you're so young and everything is solved and you're fine.
Oh,
and
yes,
then no
scars,
no scars and no damage to anything. Because, with chemo, you might even survive it. But then years later, it shows up the damage that was done because of the chemo. So you don't even have that. That's great. And
yes,
I'm really
exactly.
happy about that.
And I'm very thankful for that.
And, it was easy. Only 3 days. That's nothing.
I know.
Nothing at all. That was
I'm very happy about it.
And thanks to Deborah, it was her sad experience to go through all of that before that made the difference.
Oh,
you there, Deborah?
Yes.
Yeah. And that's why you did it.
In retrospect of myself, that's the only thing that I can say that I wish for myself that could have been different is in Krystal's case, because would have been to find Dr. Carpenter in the beginning at 2004 and not so long advanced.
Yeah.
But I'm thankful that I found you, period. So thank you.
But it would have been better if you could have come early. It would have been a lot less expensive. Would have not been all the pain you went through, not all the difficulties, mental strain, or what they were telling you. Would have been so easy, But that's because they're trying to keep it hush. That's why it's going on. Yeah. And now they are trying. People were happy. Oh no, we have to put a stop to that. That's why they're doing character assassination, and it's hard to fight.
Yes.
But I really appreciate you coming on and telling everybody what is going on. If they like their doctor and they want to have chemo radiation because they think it's a safer thing to do, well, that's fine. I don't think so, but they can think what they want.
That's right.
But leave people that want to do something else, leave them alone. That's my...
Absolutely. Absolutely.
But it was great to hear both of you doing so well, being happy. And that's what I want. That's why I had a party for you when you left. You went through all those days. I wanted you to go home.
Thank you so much. It really did. It was just like being home, away from home, because that was an awfully long ways away, and I'm just glad that you were so kind through all of it, and it just made it all the better. Yeah.
I want to say something. You told me the other day that when you went in, because you have fluid in your lung, they had to drain the fluid and everything, and all the things they were trying to do to you. You said you heard a voice that was telling you to get the hell out of there.
I really did. People will believe that, or they don't believe it, or they'll make something out of it, or whatever they would like to do. That people will always say, "Oh, she's just a nut" or something. But honestly, that's what did happen to me that's exactly what happened to me in that doctor's office. Was I heard a voice loud and clear, and everybody else is, they're chitter-chattering around me amongst one another and looking at the X-ray and all that. And I just truly did. I heard a voice say, "Get out of here. You can do this." And I mean,
let me tell you.
I packed up and I left.
I don't know. And let me tell you something. I don't know if you believe in telepathy or not. I think people have the ability of telepathy. It's just very difficult. But I was very worried about you, and I kept saying, "Deborah, just get out of there." I remember saying that,
Oh, that's awesome.
Maybe some waves got to you that way. I don't know.
That's right. Telepathically, you can send me the message.
Yeah, I think so. Something must have gotten through, because you got out. You're a very smart lady, though, so... And unfortunately, not all the patients are. And the other day, I got so aggravated about things that go on that I said, okay, what I'm going to do now, I'm going to introduce an IQ test. And if the patient doesn't pass it, they can have the treatment.
Oh, my.
So, all right, that's great. Thanks a lot.
Well, thank you
for telling me.
I truly do hope that anyone that has listened to this, get that knowledge, wisdom, and understanding behind them, and don't just poo-poo something off, just, out of their mouth. Just do some research, get an understanding of how things work, and by golly, for people, I never dreamed I would have this either.